For placement 3, students will be going on 2 weeks in subacute, which is rehabilitation, and 2 weeks in acute. For the placement logbooks, we've separated these 4 weeks, so the 2 weeks and then the 2 weeks, to make it easier for the facilitators to complete. The first sections of the placement logbook are all the same, but obviously the observation checklist will be unique to the placement. The logbooks are relatively similar to previous logbooks. There's just been a couple of changes. So pretty much the same. There's just been a couple of minor changes. So with the checklists and with the sign-offs, obviously the facilitator log section's the same. And the hours that you work are the same. You need to make sure it's just the 10 days because it's just the 2 weeks. And then here we've taken out the initials just to make it easier for the facilitators to complete. So these are the standards that we believe are appropriate at that level in the course. And then this section obviously is just some supervisor comments relating to the standards. The learning objectives, and then obviously the skills that you've learned in lab. We've changed the learning objectives to SMART measurable goals that we've been working on in class, and we've also included all of the Rolf, all the reflections in our Rolf, the Rolf model. This is for the facilitator, and then it just summarises the units of competency. The thing that has changed is just at the start of the section D, where I had this table, but I've actually amended it to have additional information. And these skills here are basically what the checklists encompass. So if you complete the checklists, these are the things that you ultimately have to complete as part of those checklists. It's just them really, really abbreviated. So this is just a bit more for the students to have a bit of a list of what they need to complete. So for example, one simple, one complex, a simple and a complex, or a complex, sorry. So just the 3 wounds that need to be completed, and for each of those wounds there's a reflection. So it's just a quick way to make sure that you're meeting your requirements for placement. As you can see here, students need to provide nursing interventions for 2 people with chronic health problems, it's 1 and 2, and again student reflections for both those patients. This section here is for the hypoglycemic patient. Caring for a hypoglycemic patient and a hyperglycemic patient, and then writing a reflection. So this is a summary of the checklists. Okay, so this is the first one here, which is apply principles of wound management in the clinical environment. So basically a simple wound is any wound that does not require any other dressings besides a dry dressing. So a complex wound dressing would be a moist dressing, or a dressing that requires ointment or other special care. So we want you to do just one simple dry dressing and then one with more complex moist dressing. This one here can be either or. You only need to do 3, but 1 simple, 1 complex, and then 1 simple or complex. This is the basic skill that you've been taught in SimLab, so just the process in which to do that dressing. As normal, the feedback is provided, and then here we want the students to think about the Rolf reflection model and think about what the simple dressing wound looked like, and then the care that you gave and the education you provided to that person. And then again, for the complex wound, same thing, where it was, what was different about it, what made it complex, and then for the third one, and make sure you stipulate whether it was simple or complex. For the next checklist, implement and monitor care for a person with chronic health problems. You'll be required to care for 2 different people, so you should complete this checklist fairly simply. The wound one will be, you might need to seek out the wounds, whereas caring for people with chronic health problems is something you'll do every single day. So these are all the requirements that we talk about in class about providing education, speaking to the way in a manner that they understand, and explaining the different services that are available to them. And whilst patients with chronic conditions are living with them long term, it is important to remember to assess them on a daily basis and assess whether there's been any improvement or decline. That's pretty self-explanatory, just making sure that you're thinking about that early in your placement to get it ticked off, because it will be easy to complete, because like I said, the majority of the people you look after will have a chronic health problem. So for the reflection, we want you to describe, listen and describe what that condition was, and then perhaps any services that that person may have required. So for example, they might have a history of heart disease and they require home help or cardiac rehabilitation, education, that sort of thing. And then thinking about the clinical needs of that person, so how you apply your nursing practices. So for example, if they're short of breath on exertion, those kinds of things, supporting the patient. And how did you make a positive contribution to that person's outcome? And also what strategies were effective in helping the person understand more about their condition or their family member. Obviously, it's the same again for the second condition. The next checklist is the diabetes checklist. So I mentioned earlier that there's a hypoglycemic person that you need to care for and a hyperglycemic person. For this observation checklist, a hypoglycemic person is a person with a blood glucose level less than 4, and hyper is someone who has a blood glucose over 8. So you will see people with probably sugars higher than 8, but not all diabetics will have hypoglycemic levels. So it may be that you need to speak to your nursing buddy or facilitator to identify any unstable diabetics that are on the floor, or people that have come in newly admitted with unstable diabetes or hypoglycemia. So you can see here the checklists are basically identical except for the hypoglycemia in this one and hyperglycemia. And if students do see a person who is suffering from ketoacidosis, we would like to have that observation checked off as well. We understand that that may be difficult to capture that person. Down here we have the reflection for the hypoglycemic person, as I said, blood glucose level lower than 4. And then the hyperglycemic was blood glucose over 8. Okay. And then obviously the reflection includes describing how the patient presented, the signs and symptoms. You might be able to provide urinalysis that demonstrates that they're positive for ketones, or that they have arrived with high blood glucose levels noted on their blood gases or on their pathology that was taken in emergency, that kind of thing, as well as if they are an existing diabetic, their normal regime, or if it's new, the new regime for that person, and strategies that will help that person meet their management requirements. The next table here is just the beginning of Cluster 7 checklists. So as we know, it's administering medications, and for this unit you need to administer medications to 3 people, and you need to do 4 reflections. Now, excuse me, it's important to remember that whilst you need to do oral reflection on oral medication administration, subcutaneous, intramuscular and peripheral IV, at this placement you won't be providing peripheral IV medication, but you'll have patients that will have required IV medication at some point, or intramuscular medications at some point. So whilst your patient may not require them, what we ask is that you preferably use the medications that your patients have prescribed, because obviously if they're on them you will have looked them up and you'll know what they're for, so it will make this task easier for you. If you don't have any patients that have IV medication, then you can randomly select it, but I'll explain that further down. This is just where you check off to keep a tab or a list of where you're at. This is the first checklist, and so you must administer medication to 3 people, 1, 2, 3, oral or subcutaneous medication. Okay, so this one here is first oral medication, 3 oral administrations, and obviously you know the 8 rights that we teach and the requirements associated with administering medication from all your practice and competence that you've demonstrated. So that's the oral checklist. See how it says oral in red, and then the next one in red is subcutaneous. So you only need to do 2 of those. So 3 oral and 2 subcutaneous. And you just need to get satisfactory for all of those. If, for example, you administer medication and you are noted to have done something that was incorrect, and so the nurse that you're working with is taken over, for example, you might not be satisfactory at that point. You might not have washed your hands and they noted that. So, but that's okay, because as long as you demonstrate it the next time, you'll still need to demonstrate it 3 times though. So it'll be, if it's not satisfactory here, you will need to get this satisfactory here the next time. Okay. And obviously here it's just the summary from the supervisor and then your response. And then we want you to provide a reflection on the medications that you administered. So the oral medication, the subcut, the intramuscular and the IV. The thing to remember here, if your patients are not prescribed a medication administered by any of the above 4 routes, well obviously the first 2 you will, but the bottom 2 maybe not, you may randomly select a medication. Like I said, ideally use the medications that you've looked up already that your patients are on. It'll be much easier for you and you'll know all this information. Okay, so you need to complete this section. So that's the oral one, this is the subcutaneous reflection, this is the intramuscular reflection, and this is the peripheral IV reflection. The Part E professional development we've slightly tweaked by adding in this algorithm here so that it's very clear what will be happening if you've been identified to have any clinical deficiencies whilst on placement. So obviously if, say for example, you've demonstrated that you have been unsafe in administering medications, for example, you'll be set some goals to ensure that you meet the requirements of the checklist, and the facilitators will assess that to competence and determine if it's safe for you to continue or whether you should be removed from placement. If you're unsuccessful in meeting the goals set, then a learning contract is commenced and VFA learning becomes involved. We will do an independent clinical review to assess whether you're safe to continue or should be removed from placement. This is a document that the facilitators will use to help them assess where you're at if you're underperforming. And this is the contract that would be developed in response to the underperforming student. This is just if you attend any in-services. And this section is where you submit your logbook to reception on completion of placement. And it's not submitted unless all of the sections in blue that you're required to complete are filled out. It is also your responsibility to ensure that the clinical facilitators have completed all their sections, including all of the observational checklists. Okay, so all your blue bits need to be complete and all the yellow bits need to be completed by the facilitators before placement finishes, not after. Down here is where VFA Learning will just go through and assess your competence against all the units contained within that particular cluster. These appendices are for any students that didn't complete the admission and discharge checklist on placement 2 or the primary care health checklist on placement 2. So hopefully you won't require this section.